Because of you, our nurses, excellence can be found at Mount Carmel. You offer exceptional care and compassion while collaborating with each other to find the best way to treat our patients and their loved ones. You take pride in yourself by offering the highest quality of care to everyone. You look beyond the surface of medical diagnoses to see how else you can help our patients and their families to be comfortable and reassured. You spend extra time with them. You hold their hand. You make special things happen.
I teach a gerontology course, and we have a clinical portion attached to it where the students interact with older adults in various settings. And there was a gentleman who was kind of off to the side in what we call a jerry chair because he had a very severe stroke. And one of his arms, as a result of the stroke, was severely contracted, which means it was brought up and very tight. The one student, while she was working with him and manicuring his nails, she looked at me and she said, "What about his other hand?" And I said, "Well, let's just start and see what happens." And so just start stroking his hand gently to try and reduce the swelling, and then just massage it and see if you can get his fingers to open up. I went off to see other students, and when I came back, the gentleman was sitting more upright in his chair. His eyes were a lot brighter, and his very contracted hand was fully extended and laying on the arm of the chair in a very natural position. It is small little incidences of what I call mini miracles, where they are able to make a difference in someone's life in this moment in time. In order to really understand what you can accomplish as a nurse, you have to be able to look for the impact that you are able to make. That's the difference.
Taking care of not just our patients, but our patients' family members is something you do every day. The care you provide to the family can make all the difference, whether it's a simple trip to the doctor or a life-threatening situation.
June 8th of 2014, we were actually getting ready to start a trip to Maine to celebrate our 15th wedding anniversary. And we both had the flu. I was getting better, but John wasn't. And fortunately, Mount Carmel had opened the new Grove City emergency room. When we got there, I fully expected them to say, "Yeah, you're a 49-year-old male with the flu, and we're going to write a prescription for Tamiflu and send you home." But Dr. Kanzler said, "We'd like to admit him." I got a phone call in the middle of the night that said he went into respiratory failure, he is in a drug-induced coma, and we'd recommend you come to the hospital. What was interesting was there's just a whole team of doctors and nurses and paraprofessionals working with the family, and what I truly found is there was a continuity of care. The nurses were phenomenal in their care. They were supportive to me. Even a small kindness means a great deal. There was a night nurse. She knew that our anniversary was going to happen while he was in ICU in a coma. And so she got some folks together, and the night nurses put cards in the room. And so when I came in for visitation on the morning of our anniversary, there was my husband, and there was cards from people who didn't know us, but wanted to make sure that they knew this was important.
When I woke up almost a month later, and I put it all together, I said, wow, they saved my life. Because of my health, I ended up retiring, and we celebrated with a retirement party. And we also felt it was appropriate to tell people that if they wanted to bring a gift, they could bring a check to the Mount Carmel Foundation. And there were several people who did that, and we thought that was also a way of celebrating the fact that Mount Carmel was the reason that I'm still here.
I would say that our love story continues because Mount Carmel cared. Thank you for giving me John back. Thank you for giving us more years together.
Whether it's a mini miracle, giving someone back their dignity, or a life-saving event, you are there through it all, giving your time, energy, compassion. Simply being a nurse.
I started working with this program in 2002 as a casual nurse on the mobile unit, and then over the process of time I ended up being the manager and love the work we do. The services we provide with the Outreach Mobile Coach is that it is a urgent care that serves people who have no health insurance or who have barriers to accessing health care. The first time as a triage nurse that I sat down with a homeless patient and tried to get an address as I was filling out my paperwork, and the patient said, "Lady, what do you want me to say to you? You know, like second tree from the left, you know, how can I answer that?" And I walked away from that experience realizing, wow, even the basic things that we have and sometimes take for granted, like an address, is really valuable. I think the ability to connect with all kinds of people, and something I've learned and that I think that my team has learned, is not to determine what that patient needs, but allow them to determine what they need. We had this one gentleman that he would come and see us, you know, periodically for years, and we would talk to him about getting into rehab. He was an alcoholic, and one day he just showed up and said, "I'm ready. You know, it's time." And he came in and we got him into rehab, got him into some services, and he was sober and a different person. And his smile would just light up the room whenever you seen him. He was just such a changed person. It is a very fulfilling role to me. Overall, the mission of what we get to do. We live out the mission of Mount Carmel every day.
You go the extra mile. It's what you do. And for that, we thank you.